Welcome to the initial first virtual support group that we have here at Halifax Health. I wanted to welcome everyone to know that our goal here is to help reinforce discharge information while exposing stroke survivors and their caregivers to current information on how to navigate life after stroke through the virtual monthly talks. So we plan on holding this virtual discussion once a month, second Tuesday of every month at the same time. And we'll have a variety of different topics. And I'll put that out on the Facebook page and have that shared with everyone who is of interest. You can email me at thestrokesupport@halifax.org, and I'll be more than happy to share with you the upcoming events. And now we're going to get going on our discussion today on the management of risk factors for stroke. As most of you may or may not know, that there are risk factors for stroke, and if we are able to modify those risk factors, we can reduce our chances of having a reoccurrent stroke or an additional stroke or an initial stroke by 80%. There are non-modifiable risk factors that there is no way that we can adjust those. Non-modifiable. That would be our age, gender, race, and ethnicity, and heredity. For age, the likelihood of a stroke increases with age in both males and females, but that is not the case in every stroke. We're seeing more and more cases of middle-aged persons as well as young teens as well. So age is almost not a factor as much anymore, but the greater percentage of patients who suffer from a stroke are over the age of 55. Family history: if a blood relative has had a stroke, especially prior to their 65th birthday, you personally could be at greater risk. And race: Black Americans, Hispanics, and Latinos have a much higher risk for death from stroke due to their propensity for hypertension, diabetes, and obesity. A lot of times, a lot of patients don't even know they have hypertension, and again, hypertension is the number one cause of strokes. Again, non-modifiable. Gender: women have a higher incidence of stroke than men, and strokes kill more women every year. This is an interesting statistic because more often the stroke is effective of the women, causing them mortality than breast, ovarian, uterine, and cervical cancer combined. So it really is a concern. And if we have the ability to modify any risk factors to improve those chances, we should take heed. Hormone therapies, especially when combined with smoking, can increase a woman's risk for stroke. And again, if you've had a prior stroke, TIA, or heart attack, there's a much higher risk than someone who has not had one of those. And a person who has one or more TIAs is almost 10 times more likely to have a stroke than someone who has not had one. We should consider the TIA component more in the regards to like an angina, like where you have like chest pain with activity, but it doesn't present as an MI. You should consider, if I'm having symptomology similar to a stroke, I should have that checked out so I can adjust my risk factors. A patient who's had a heart attack is a much higher risk for a stroke as well. And the heart attacks are caused by plaque buildup in the heart, and many strokes are caused by plaque buildup that causes blockages to the brain. 1 in 4 clot-related stroke and heart attack survivors will have another stroke. So this is a pretty big statistic. Any previous ischemic stroke or heart attack could put you at a higher risk to having a second one, and that's why the education post-discharge and the modifiable risk factors are ever so important. Of ischemic strokes and heart attacks, we can prevent these up to 80%. Managing our blood pressure, cholesterol, diabetes, and making healthy life choices and taking medications is recommended by the doctor. Now I have, I'm going to go through all the modifiable risk factors and little things that we can do and pay heed to. Hypertension, as I stated before, is the number one cause of stroke. It's the single most important risk factor to modify. Where that leaves us is we really have to consider knowing what our pressure, we have to know our numbers, right? So manage your blood pressure at home by going and getting your blood pressure tested at like a CVS or a Publix in those free machines, or if you invest in a machine to test your blood pressure at home. That's the single most important thing to try to keep up on, keep a log, see if there's changes and dietary changes that you do that may change your blood pressure. And when you see your physician, it's very important to go back and speak with them in regards to that. Smoking, we need to consider stopping smoking because it damages the blood vessels. Diabetes doubles your risk for stroke. So having high blood sugars can be very problematic in more ways than one. High cholesterol increases your risk for blocked arteries. Excessive alcohol use, average of 1 or more drink a day for women, or 2 drinks daily for men can lead to hypertension. So that's where the excessive alcohol use can be problematic. Physical inactivity and obesity, being inactive, obese, or both increase your risk for heart attack, heart disease, and stroke. Obstructive sleep apnea. Now, again, mind you, all of these risk factors are not in any particular order. The obstructive sleep apnea is when you have periods of apneic breathing during your sleep time. A lot of times our partners will notice that as opposed to anyone else. It's when your partner's sleeping and they may just stop breathing for you're counting. You're like, oh, are they going to take a breath? They're going to take a breath. And then they take a breath. Maybe snoring participates after that. That is periods where you're not getting oxygen into your body and can increase your risk for stroke. Illegal drug use, cocaine, ecstasy, amphetamine, if I can't even say that word, but that and heroin can increase your risk for stroke. Carotid or other artery disease. The carotid arteries in your neck supply most of the blood to your brain. If damaged by plaque, you can get a clot that will form in the carotids and then could either occlude the carotid from sending blood supply to your brain or actually send a small infarct, a small little clot up into your brain, blocking vessels higher, deeper into the blood vessels there. AFib or any other heart disease can cause a 5 times more likely chance of having a stroke. The AFib is when you have the upper chambers of your heart that quiver and they don't actually sync up with the beating of your heart. And that can just take the blood and kind of pool it around and cause little clots to be expelled. Patients with strokes with these types, like AFib, can experience more than one side stroke symptoms, which can be very interesting as well. You can have right-sided issues and left-sided issues from the clots being spread everywhere. A lot of anyone who's been here and been discharged should have gotten experience with the stroke risk scorecard. This is also available on American Heart Association website. But this is a good way of kind of looking over your modifiable risk factors. We have red, yellow, and green, and it kind of makes very interesting sense as regards to high risk, caution, and low risk. Now, just recently, the American Heart Association has come out with blood pressure parameters for norm being below 120 systolic blood pressure over 80, which initially was back to, they had it at 130s a couple years ago. Now that's where they want you to be. I mean, that seems low for a lot of people, but some people sit there and that's okay. But these are items that you have to have conversations with your physician about how to get there. Sometimes if you have chronic hypertension, it's very difficult to get down quickly, and you have to do it in a very steady paced way so that you reduce your risk for stroke. Again, reiteration, AFib, smoking, cholesterol, diabetes, physical activity, weight, and stroke in the family. So it kind of goes over the high risk, caution, and low risk. If anybody's interested in getting a copy of this scorecard, just email us at the stroke support at halifax.org, and I'll be more than happy to share that with you. Now, there are 8 steps to take control of our risk factors that I wanted to go over, and it's going to be another reiteration of the discussion earlier. But I think it'll be helpful. As you can see here, we want to talk about managing blood pressure, controlling our cholesterol, managing our blood glucose, being active, eating better, losing weight, quit smoking tobacco or vaping, and then take your medications as prescribed, and always check with your doctor before making any changes. In managing our high blood pressure, we need to know our numbers, like we talked about before, and check your blood pressure regularly. Keep track of it, write it down, keep a little log. That's probably the best way to keep a score of your blood pressures. Some patients have a tendency to get a little nervous when they go to the doctor, and they claim they get a little white coat syndrome, where their blood pressure will go a little higher when they go to the doctors. And if you have a really good log, and you can show and prove that your pressures at home have been better, this way you have a little more conversation with your physician over your management of your blood pressure medication. You don't want to get on a high dose blood pressure medication and then actually have low blood pressure and maybe be dizzy from it. So that's why it's really important to be in control of a little bit more of what's going on with you and your management of your medications and your blood pressure. Adjust your diet and activity level. Again, sodium can increase your blood pressure, so low sodium diet is very important. And activity helps actually reduce your blood pressure, believe it or not, in small doses of activity. And take your medication as instructed, and make sure you talk to your doctor about anything that is causing you to feel different or uncomfortable with your blood pressure medication. Blood pressure is going to make you feel different when you start getting it managed. You'll feel maybe a little tired for a little bit. It takes a while to adjust to those medications. So discuss with your PCP, but don't just stop your medications. That could be very detrimental. Controlling your cholesterol, know the good from the bad. The LDL is considered your bad cholesterol, and this cholesterol component contributes to fatty buildup in your arteries. That's why they usually have most of these patients on a statin. Being on a statin or on a modified diet to reduce your bad cholesterol intake or foods that contribute to that is very important. After a stroke, the goal from the American Heart Association is to hit your LDL to 70 or below. So if your LDL is, let's say 100, that about 8 years ago was appropriate and what they had deemed the right level to be at. They have since retracted that and decided that it has to be lower to reduce your risk, and 70 is the goal, 70 or below. Blood glucose, and this is where we have our fasting blood glucose levels, where we do those finger sticks at the doctor's office, and they tell you, they tell you the news about your blood sugar. Not everybody who has had a stroke has diabetes, but it is a contributing factor, so it's something to consider. Fasting blood glucose of 126 or higher should be monitored, and by diet control and exercise, usually you can modify those sugars and get them down over the course of a couple of months. So that's something that you can consider doing to modify your blood glucose, hopefully without the need to go on insulin. If you do need insulin, you need, again, to monitor your blood sugar appropriately, or taking anything like glucophage, you need to also, again, be aware of your diet and your blood sugar. Activity, just 150 minutes of moderate, intense aerobic exercise a week can lower your cholesterol and blood pressure and blood glucose. So I know with post-stroke patients, it can be very challenging to increase your exercise based on what dysfunction you're exhibiting. If you have like a leg issue, you have an arm issue, some of these exercises may or may not be the right one, but there's a lot of other options out there. Brisk walking, swimming, bicycling. So I have quick way to kind of give you an idea here is like 10 minutes of stretching is like walking the length of a football field. So little increments of new ways of moving and considering activity are really important. 2.5 hours of walking every week, so you can break it up throughout the week, is like walking across the state of Wyoming. So that is very interesting as well. And 30 minutes of singles tennis is like walking a 5K. You know, all depending on what you can and cannot do. You can take that into consideration. An hour of dancing a week, again, is like walking from Chicago to Indianapolis. 20 minutes of vacuuming is like walking a mile. 30 minutes of grocery shopping every other week is like walking a marathon. So be aware of your exercise and, consider adding to it. Mobility is really important. And there are a lot of adaptive sports that are available out there. And if you need more information about that, again, please email me and we can get you in touch with someone who may have more information about different options for patients who may have some adjustments in their movability. Eating better, healthy eating starts with healthy food choices. Decreased sodium, sugar, saturated fat, and portion sizes are good ways to start healthy eating habits. Also, I've talked about documenting our blood pressures. Documenting what you're eating is also a really good way of keeping yourself accountable for what your intake is during the day. Write a food diary. Write down what you have for breakfast, lunch, and dinner, and then, figure out, you can actually sit down and figure out your calorie intake for the day and see what modifications you can make. Talk to your PCP about that. There are dietitians in a lot of these PCP offices that can help redirect like certain diets. You can also just look on American Heart Association too, and they have a lot of good recipe books that are free to the public, and you can download things that would help you modify your diet. And losing weight goes with all of the above, right? So if we increase our activity and we eat better, we should be able to lose some extra weight as well. And knowing how many calories you're eating a day helps with that. So again, the food log, and use at least as many calories as you take in. When you have a positive amount of calories and a decreased amount of calorie utilization, that's where we gain our weight or stay at the same weight. And that's why we have to make those adjustments to increase our activity level and change our food choices. We want to go with not calorie dense foods. So we have to keep in mind like free sugars are not very good. Stay away from white bread. All of those things that we all have heard before in the past. Quit smoking is, I cannot reiterate this enough. It's very, very important if you do have an issue with smoking, tobacco use, or vaping, to really try to quit. And I have a couple of steps here that may help. There are 5 steps to quitting. So you want to set a quit day. Put in your mind, put it on the calendar, say, okay, this is the day we're stopping to smoke. Now there's 2 choices. You can either quit cold turkey, and sometimes that works, sometimes it doesn't. It depends on the person themselves. Or you can actually cut your intake in half. Say you smoke 10 cigarettes a week or a day, let's say. 10 cigarettes a day, cut that down to 5 cigarettes a day for 2 days, and then half that again, so 2.5 cigarettes for 2 more days, and then 1.5 cigarettes for the next 2 days, to 1 cigarette to no cigarettes, and have that no cigarette time be your quit day. Talk to your doctor for medical support, because there are medications and things that you can use to help you with the quitting. Plan healthy snacks in ahead of time if you're planning on quitting, so that you have something that can you can fill yourself with when and if the cravings occur. Sugar-free candies, you can suck on that. That helps a lot. Mints, things like that. And then make sure you quit on your quit day. Again, one of the last steps is to take your medications as prescribed and always check with your doctor before making any changes. The most important thing is, like, if you were an AFib patient and you were on an anticoagulation medication, we can't just stop those. So if you know that you financially may not be able to afford like an Eliquis or a Pradaxa or something that's more expensive, please have that open conversation with the physician so that we can give you alternatives to help with the anti-clotting factors so we can reduce your chance of having a stroke. I see a lot of patients who come in who have AFib who've stopped taking, the more expensive anticoagulation medications and ended up clotting and having a stroke because they may not understand the benefit of the medication. So if you've gotten a free sample of it, make sure you talk to your physician before you run out so they can put you into another medication to take its place, or bridge you over to another medication that's less expensive so that you don't run the risk of a repeat stroke. It's very, very important. So in summary, the same components, these are the 8. Manage the blood pressure, control your cholesterol, manage your blood sugar, make sure you try to increase your activity as you're able, eat better, make better choices, better food choices, and all of that should effectively help you lose some weight. Quit smoking, take your medications as prescribed, and always, always check with your doctor before you decide to stop taking a medication, and to talk about alternatives. And that is it. Any questions? Anybody have anything they want to discuss? So this was our first try at this. We have many more meetings set up like this. So I have different evaluative meetings. So we're going to be talking about carotid revascularization in one of our meetings. We're going to be talking about advanced directives in stroke. We're going to be talking about caregiver support and community resources. We're going to be talking about physical sides of recovery. We're going to have our CIR partner come in, which is our inpatient rehab that we work very closely with, to have an open discussion in regards to rehabbing next steps. We have a doctorate who's going to be coming in to talk about neurobehavior and neurocognitive and neuropsychological aspects of stroke as well. So we're open to having lots of different discussions on different sections, and increasing the education as we go along every month. So if anybody has any particular suggestions or has a discussion that they'd like to have us present, if you could email us with your suggestions, we'll definitely set it up and have us try to get that to fruition for you. Okay, I'm going to give you guys about 10 minutes to, if anybody has any particular questions or they want to input anything, just let me know.
Hi, Samantha. Can you hear me okay?
Yes.
Hi, this is Judy B's family.
Hi.
Hi there. I just sent you something on chat, thanking you for your time with the presentation today. It was a really good refresher.
Thank you.
One thing that we're looking for my mother, because she suffers from aphasia due to her type of stroke.
Yep.
But we're now, because her speech has gotten so improved, that we're now starting to look at the neuropsychology realm for her.
Okay.
So having some additional information on that and how all that kind of goes into play would be a really great kind of lesson for us all here in the family to learn about a little bit more. Like I said, we're just getting started with it.
Sure.
Just understanding like, okay, hey, her referral came in, so she's going to go get tested. And then from her testing, like what's included with her testing? How does that work? And then from her testing results, what's the next steps that kind of goes to? So we're trying to understand it the best we can, but we're just not all there yet. So we're just kind of taking it as
One step at a time.
Yep.
Now we have Dr. Rankin's he works with us through Brooks Rehab, and he's going to be speaking about the neuropsychology aspect of it on December. We kind of have our planned out for the year so far, but what I could do is if you want to email me some specific questions, I can run it past them to kind of give you an overview so you're kind of prepared for the next steps with your mom.
Yeah, that would be great. Thank you.
You're welcome. I think the discussions that we're going to be having I want them to be fruitful and I want them to be beneficial to everyone. So any suggestions or any concerns that anyone has, I'd love to hear it so that we can make it a more eventful meeting month to month.
Sure, absolutely. I happened to cross this. I was the one that emailed you this morning in regards to it. I just happened to cross this on a social media profile, and that's the only way that I knew about it. So I was like, hey, because our other stroke groups have been canceled for right now because of the virus. So having this go virtual has really been good for all of us. So I'm glad that the virtual meeting and being able to share the information kind of had the group is to me, it's a really great thing.
Awesome. We were hoping that we would be able to be available to many more people this way, because also getting out and getting to where you need to go for these meetings can be a little arduous at times. So it would be nice to be able to just sit in the comfort of your own home and be involved.
Yeah.
And we thought that might make better communication for everybody. We have an aphasia group I know that meets in the area. Have you been going to that group in the past?
No, it's just we're here in New Smyrna, so it's a local stroke support group that was here in New Smyrna.
Oh, okay.
So that when I'll email you in regards to the other information, and I'll put that down too as far as knowing about the local aphasia group too.
Yeah, because I can share that with you, because there's a couple of speech pathologists in the area that actually do that, and they might meet differently. I know that usually with the aphasia groups, it's important to be in person for that, but we might be able to come up with something else in that regard. This meeting we kind of put together we kind of slapped it together, and I hate to say that terminology, but we kind of slapped it together last minute because we really wanted to kick off and get started, so that we didn't get a lot of presence on social media. But for next month's event, which is going to be July 14th, it'll be the second Tuesday of the month at the same time. We're going to hopefully be able to advertise better so that we can reach more of a diverse group.
Sure. Well, we're glad that you did. Thank you.
Oh, I appreciate it.
You bet.
And so email me at any time if you have any other questions. I'll be more than happy to help with any filling in any empty boxes that you guys might have left over from the going through the whole process. It can be very arduous.
Okay. Well, thank you so much.
You're welcome. And I guess if anybody else doesn't have any other questions for me, we're going to wrap it up a little bit early, but email me again at strokesupport@halifax.org, and I'll be more than happy to get out any information, give you more information that you may find that you're missing, anything that could be helpful to recovery. Just let us know, and we'll be more than happy to review anything that we need to. I'll give you back the rest of the time, and hopefully we'll see you all again on the next meeting, which is going to be July July 14th. And again, look for the social media piece because it'll be an additional invitation that we have to send out.